This medication is used to temporarily treat cough, chest congestion, fever, body aches, and stuffy nose symptoms caused by the common cold, flu, or other breathing illnesses such as sinusitis, bronchitis. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up the mucus. Dextromethorphan is a cough suppressant that affects a certain part of the brain, reducing the urge to cough. Decongestants help to relieve stuffy nose symptoms. This product also contains acetaminophen, APAP, a non-aspirin pain reliever and fever reducer. This medication is not usually used for ongoing coughs from smoking, asthma, other long-term breathing problems, or coughs with a lot of mucus unless directed by your doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. Now, let's talk about how to use Vicks Dayquil Severe Cold Flu. If you are using the over-the-counter product, make sure to read and follow all directions on the product package before taking this medication. You can take this medication by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. It's important to drink plenty of fluids when you use this medication unless otherwise directed by your doctor, as the fluid will help loosen the mucus in your lungs. If you are using a liquid form, be sure to carefully measure your dose using a medication measuring device or spoon. Do not use a household spoon because you may not get the correct dose. For some liquid products, you may need to shake the bottle well before each dose, so be sure to check the directions on the product package. The dosage of Vicks Dayquil Severe Cold Flu is based on your age, medical condition, and response to treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval, as improper use of this medication may result in serious harm. And remember, if your condition lasts for more than 5 to 7 days, gets worse, or occurs with a headache that doesn't go away, rash, or fever lasting more than 3 days, be sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Vicks Dayquil Severe Cold Flu include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, contact your doctor or pharmacist promptly. If your doctor has prescribed this medication, it means that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, you should tell your doctor right away if you experience any serious side effects, including mental/mood changes, such as confusion, hallucinations, shaking, tremors, weakness, problems urinating, or fast/slow/irregular heartbeat. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed, contact your doctor or pharmacist. It's recommended to call your doctor for medical advice about side effects or report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call 1-866-234-2345 to report side effects to Health Canada. Acetaminophen is one of the ingredients in Vicks Dayquil Severe Cold Flu. It's important to not exceed 4,000 milligrams, 4 grams, of acetaminophen a day for adults, as taking too much may cause serious liver disease. If you have liver problems or are giving this medication to children, you should take less acetaminophen. Always check the labels of your other medications to ensure they do not contain acetaminophen, and consult your pharmacist if you are unsure. If you accidentally take too much acetaminophen, it's important to seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes/skin, and dark urine. It's also important to avoid alcohol while taking Vicks Dayquil severe cold flu, as daily alcohol use, especially when combined with acetaminophen, can cause damage to your liver. Before taking Vicks Dayquil severe cold flu, make sure to talk to your doctor or pharmacist if you have any allergies or medical conditions. This product may contain inactive ingredients that could cause allergic reactions or other issues. It's important to let your doctor or pharmacist know about your medical history, especially if you have breathing problems, diabetes, eye problems, heart issues, high blood pressure, kidney or liver problems, overactive thyroid, or trouble urinating. Also, be cautious about using this medication if you have diabetes, alcohol dependence, liver disease, or phenylketonuria, PKU. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It's also best to avoid alcoholic beverages while taking this medication. If you're pregnant or breastfeeding, be sure to discuss the risks and benefits of using this medication with your doctor. For older adults, it's important to be aware that they may be more sensitive to the side effects of this drug. As always, before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware of potential drug interactions with Vicks Dayquil severe cold flu. Always consult your doctor before starting, stopping, or changing the dosage of any medications. Avoid taking certain MAO inhibitors with this medication, and be cautious with products such as ketoconazole and levoketoconazole. Additionally, be sure to check the labels on all your medications to avoid taking more than one product with the same ingredients. If you are taking other products that cause drowsiness, such as opioid pain relievers or antihistamines, make sure to inform your doctor or pharmacist. Lastly, be aware that this medication may interfere with certain urine lab tests, so it's important to let your lab personnel and doctors know you are using this drug. If someone has taken too much Vicks Dayquil severe cold flu and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, agitation, confusion, hallucinations, and seizures. Remember, if your doctor has recommended Vicks Dayquil severe cold flu for you, it's important not to share it with others. Be sure to attend all your medical and lab appointments as directed. If you usually take Vicks Dayquil severe cold flu regularly and happen to miss a dose, take it as soon as you remember. However, if it's almost time for the next dose, it's best to just skip the missed one and take the next dose at the regular time. Avoid doubling the dose to make up for the missed one. This medication is usually taken every 4 hours as needed, so be sure not to exceed the recommended dosage. Remember, it's important to follow the instructions on the label and consult with a healthcare professional if you have any concerns about taking this medication. It's important to store Vicks Dayquil severe cold flu at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of your medication, it's best not to flush it down the toilet or pour it into the drain unless you're told to do so. Instead, properly dispose of the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.